I'm Simone Sheriff, and I'm a Wotjobaluk woman, and my family are from the Wimmera region in Victoria. I've been working on the SEARCH project, which is the study of environment on Aboriginal resilience and child health, for 10 years now. I started working at one of the Aboriginal medical services involved in the project as an Aboriginal research officer. And then I got offered a job at the coordinating centre in Sydney, and so I've moved here, and I'm now doing my PhD, or trying to do my PhD with this study. Yeah, that's me.
And I'm Hilary Miller. I'm a non-Indigenous public health researcher that's been involved with the SEARCH partnership for a few years. I started out looking at child development outcomes and social determinants in Aboriginal kids, and I now work at Reach Out Australia, which is a youth online mental health organisation that gets around 2.5 million visits a year, and all the resources and content on that website are developed with young people with lived experience. So it's really great to continue to be involved with co-creation on this project as well.
Yeah. And before we begin our presentation, in Australia, before commencing any events or conferences or anything like that, we like to acknowledge the traditional owners on the land that we're meeting on. And so we would like to acknowledge the Gadigal people of the Eora Nation, who are the traditional owners of this land, and pay our respects to their elders past, present and emerging, and also to all Aboriginal and Torres Strait Islander people across Australia.
Great. So just to start off with, we thought we would cover, for those who maybe aren't as familiar, what is co-creation. We use that word a lot in this presentation. So co-creation refers to bringing together of groups of people who've traditionally been separated into kind of user and producer, groups of people who traditionally haven't worked together in research as well. Co-creation is a combination of both co-design, so the designing and planning of something together, and co-production, so the generation of something new, bringing that co-design plan to life. So it encompasses both the design and the creation stages. It's a strengths-based approach to addressing community needs, and it ensures that research users and community members are actively involved, and it can really bring about transformative health benefits for those communities, some of which we'll chat through today. It's also really important because it values diverse forms of knowledge and experience, which is really critical when working with Aboriginal and other Indigenous communities whose knowledges haven't always been privileged. So by way of background, for some of the international people who are signing in today, we thought we would cover the history of Aboriginal health research in Australia. So unfortunately, there's been a history of research in Australia that has been carried out primarily by non-Aboriginal researchers without the full consultation of Aboriginal communities. So much of this research has been sort of conducted on and rather than with Aboriginal communities. A lot of the research agendas and priorities are set by non-Aboriginal people, and Aboriginal people, unfortunately, have often been cut out of those conversations. The result has been masses of volumes of research published on the topic of Aboriginal health, but not considerable benefits to health in the last sort of 20 years or so. So despite Aboriginal people being one of the most over-researched populations in the world, it's not really bringing about benefits for those communities. So it begs the question of what the processes that research is following. A lot of the research that has been done has been culturally insensitive and kind of ignored the cultural specifics of communities that it's working with. It's also been deficit focused, so largely focused on the problems of Aboriginal health, or the gaps between Aboriginal people in terms of their health outcomes in Australia and non-Aboriginal people. Often it's been interpreted without context and failing to acknowledge the unique impacts of colonisation, trauma and other social determinants and how they play out on health. So as an Aboriginal professor, Bronwyn Frederick, said, researchers have often ridden roughshod over our communities, cultures, practices and beliefs. So really it's in this context that co-creation is really necessary to recognise those power balances and privilege Aboriginal ways of knowing, thinking and being. So that brings us to the study of environment on Aboriginal resilience and child health, or the SEARCH partnership, which is the case study we'll be discussing today. So the SEARCH study was really brought about to kind of shift the power towards Aboriginal communities, to really put them in the driver's seat and lead research about them. It's the largest ongoing study of Aboriginal children in urban and large regional areas. And this was a real shift in the research area at the time, given that the majority of research had been conducted on remote Aboriginal populations, and that being despite the fact that the vast majority of Aboriginal people in Australia live in urban and large regional areas. So the study has been running since 2008 and has really been focused on also really bringing about benefits to communities, and with the motto of no research without service. So there's a real focus on actually translating data into health outcomes through expanding programs and services, using data to fund new programs, informing policy, and building research capacity within communities. So SEARCH is a huge and very complex partnership made up of multiple stakeholders. So we thought we would take you through some of that. Firstly, there's the Sachs Institute, which is an Australian non-government knowledge mobilisation organisation that works to bring researchers and policymakers together. It's also the coordinating centre from which SEARCH is based, so a lot of the research and policy officers are based at the Sachs Institute. The Sachs Institute also works with Aboriginal community-controlled health services in various areas of the state of New South Wales, where we're based. So Aboriginal community-controlled health services are really community-led organisations that allow communities to have self-determination over their health and service delivery in their areas. They're also governed by a peak body, which is the Aboriginal Health and Medical Research Council, which has an ethics department as well, and so we're signatory to their ethics department. It's worth noting that throughout this presentation, we might refer to Aboriginal community-controlled health services also as AMSs, or Aboriginal Medical Services. Those terms are often used interchangeably, so just to flag that. And then finally, there's also a range of researchers and universities from multiple disciplines and universities across Australia that we work with. So this entire partnership is what we refer to as SEARCH.
So given this past history of researchers always setting the agenda and priorities for research, SEARCH was set up to allow the communities to develop a research project based on their priorities, and a project that looked at the health and well-being of children, families and community, and looked at health holistically, to look at not just health but environmental and social factors as well. And so these were the priority areas that the communities wanted research on. So they were interested in social emotional well-being, speech and child development, resilience, ear health, housing and environment, obesity, exercise and green space. And so, as Hilary mentioned before, SEARCH has been collecting data since 2008, and we have 1,669 children and their families in the project. The research is conducted at the Aboriginal health services that Hilary mentioned before, and each of those services employ a local Aboriginal research officer to collect the data with their communities. And the communities wanted a research project that was going to follow the health of their children and families over a long period of time, and so they wanted the children and families to be followed up every 3 to 5 years. And so phase 1 of the study was done between 2008 and 2012 and collected a range of survey information covering those priority areas, basic clinical measurements such as blood pressure, height, weight, waist circumference, and detailed assessments of ear health and speech and language development. And then the second phase of the study started in 2014 and is almost complete. And in phase 2, the communities wanted to include some additional measures because they wanted to be able to look at early markers for chronic disease in our children to be able to inform policy programs and practice. And so they included doing like point of care or finger prick blood samples for blood lipids and blood glucose, and dipstick tests for urinary kidney markers. And another part of the project that the communities wanted was to be able to, you know, have their data, which they owned, fed back to them in a way that was meaningful and that they were going to be able to use. And so we have an Aboriginal knowledge broker who works with each of the communities to facilitate discussions and feedback their data in the way that they've asked for it to be. So we went around and spoke to different staff at different levels across the partner Aboriginal health services about how they wanted their data presented back to them, and yeah, how they wanted to go about these discussions. And the Aboriginal knowledge broker also assists with, so once they present their data back to them on different topics, if the community say, oh, we want to do something around this, the knowledge broker can help work with them to best use their data for local change. And we also have an expert data and knowledge hub, which is kind of like, so when the Aboriginal health services, if they wanted to say they've got a meeting coming up with, you know, education or housing, and they wanted their data around housing and health or education, we have a data person here, a biostatistician, who can run the analyses and do graphs and reports for them to be able to take to their local meetings, and they can use that to advocate for additional funds, inform policies. And so they've already been able to use their data successfully to advocate for programs locally and additional funding. And so one example of this is, you know, the communities have been saying for so long that they needed more funding around ear health and speech services. Yeah, they had lots of children who had ear disease or otitis media, and who were waiting like up to 2 years or more to have surgery, which was affecting, you know, their learning and their overall health. But through here, they were able to have the evidence to be able to go show policymakers that they needed extra funding and support to be able to get these kids seen to have surgery or speech therapy. And so in 2012, we used this data to be able to get $1 million of state funding to be able to do a program which we called HEALS, the Hearing, Ear Health, Language and Speech Services Program, which was to deliver accelerated ear, nose and throat surgeries and speech therapy through the participating Aboriginal health services. And so the funding came in, and then we gave the money to each of the Aboriginal medical services, and then they organised local surgical lists, specialists to come and do the surgery and the speech therapy, and it really helped to be able to get around a lot of the barriers families were facing as well around transport costs, waiting times, you know, racism and shame going to mainstream organisations that people were facing. And so I think, and it also, they got rid of all of their waiting lists at a lot of the sites, and it really was a good example that by delivering these kind of services through Aboriginal medical services is the best way for community. And another area in search that the community wanted was around building research capacity. So so far 32 Aboriginal staff have been given training in research methods. 10 Aboriginal researchers have been supported to complete postdoc, PhD, masters, graduate diplomas and diplomas. And we have 3 AMF staff who are about to start uni this year, so that's exciting. And all the papers published through search, they have local Aboriginal staff from the medical services involved with the interpretation of findings, writing and as authors. And also 15 of them have gone to national conferences to present their findings.
Thanks, Simone. So just to bring you to the current paper, this was an invited submission from Evidence and Policy around a special edition they had on co-creation. So after over a decade, Search has developed a successful active partnership between Aboriginal communities, researchers and policymakers. And these are people or stakeholders who don't generally work so well together. So evidence and policy and ourselves, we really wanted to understand how the partnerships were built and also how they'd been maintained for such a long period of time. We wanted to understand what had worked and why that had been the case, and any challenges that might have arisen over this time and how they were overcome. So we conducted interviews with stakeholders involved in search. We interviewed 26 different stakeholders from staff at the Aboriginal Medical Services, researchers and policymakers. And then Simone, myself and one other researcher analysed the transcripts, and we got together with workshops to identify the preliminary themes. So here you'll see our thematic schema that came out of this work. So after speaking with all the stakeholders, we identified 9 critical themes that people spoke about as being important for co-creating research with Aboriginal communities. So the 9 themes are represented within this tree. At the bottom, you'll see shared power, strong, credible leadership, and shared vision and goals were really important for providing the foundation for trusting relationships. Then we had a willingness to take risks, ongoing investment and collaboration, valuing local Aboriginal expertise, and adaptability of the model. These meant that it was meaningful and sustainable across the long-term project. And the reward of these was mutual learning achieved through connecting across cultures and empowerment of Aboriginal communities through building capacity and improving health services. So we'll take you through each of those components now. So starting with the roots and the strong foundations, the first element of that was shared power. So it was really important for non-Aboriginal researchers to have the strength to actually give up power, which is not a common thing in Aboriginal health research, and to be willing to give over some of that power and share it. It was also really important to share responsibilities, decision-making and problem-solving within the partnership, and to have a strong model of governance. And so these were all aspects that were identified by partners as being really important to the foundation of the partnership. Also important was a sense of a shared vision and shared goals. So we heard time and time again that people really felt like they were united around a shared vision of a community-led research project with a real commitment to bring about change and real benefits, and not just research for the sake of research. So this really united people even when times were tough. And the final aspect of the foundations was strong, credible leadership. So this includes Aboriginal and non-Aboriginal leadership, but the Aboriginal leadership was really critical to this. So we had some amazing founding members, including the first Aboriginal doctor to get a PhD, and the CEO of the peak organisation for Aboriginal community-controlled health services in the state. All of those key founding partners are all still involved and in the project, and this has ensured that there's a strong sense of credibility and trust in the project that's continued over time. So despite the history of research in this area, people felt like they could trust in the partnership because of that. There were also great leaders from the non-Aboriginal sector, from the medical epidemiological and knowledge translation worlds. So, and the last part of this was that leadership within the project is not led, it's not uniform, but it's actually shared. So it's many people lead the project and they lead different areas. So we had one Aboriginal person involved in this project say that when you're led by many, you have many directions that you need to look at, and this ensures that there's multiple perspectives that get heard. Okay, then moving up into the trunks of the tree, given the knowledge, or given the history of Aboriginal health research in Australia, there was a real risk associated with this project, especially at the beginning. So communities had a lot of mistrust of research and weren't sure if they could trust something. Researchers were also, was a field that hadn't really been approached before, so weren't sure how things would turn out. So there was this willingness to take risks was a critical aspect of the success of this project. It was really important. People talked about the importance of transparency and the ability to have open and frank conversations when things got tough. A second aspect was the need for ongoing collaboration and investment. So people spoke about the fact that the partnership had been so successful because people continue to show up, and that there are no shortcuts to building trust in this area, that you need to continue to show up and continue to resource the partnership to ensure that it's successful. You can't put all your energy in at the start and then expect it to be maintained over time. Another aspect of the sustainability of the project was adaptability. So recognising that Aboriginal communities across Australia are very diverse, and ensuring that the program is flexible to meet individual community needs and preferences was really critical. So as one person noted, Aboriginal people have shared experiences but different interpretations. So data is used differently in each community, and it's important to modify the model to ensure that it's working best for those communities.
And then the last area around ensuring sustainability was around valuing local Aboriginal knowledge. So all of the stakeholders felt that everyone was treated as equals in the partnership, and with kind of everyone's knowledge and expertise valued. And in the beginning, as I mentioned before, the community identified the health areas they wanted to research, and the researchers came up with some draft surveys. They showed the community, they had lots of feedback and changes. Then there was kind of a lot of ongoing consultations and changes to produce the final surveys. And so the Aboriginal Medical Service staff felt that the researchers demonstrated through that process that they were willing to listen, understand and act on community advice, and they felt that they genuinely valued their input and actually made all of the changes that the community wanted and did it the way they wanted to do. As one of the AMS staff said, the researchers, whether they were Aboriginal or not, had that respect for our community, our culture, and they valued our opinion whether we had a degree or not. Another area that was really important was around employing local Aboriginal people to collect their community's data. So, and also having local Aboriginal people involved in all the different groups in search, such as, you know, the mental health group, the ear health group, housing group. This enables to give a local context to the data and adds that richness that wouldn't be there without it. And so I think so many projects think that they can just have any Aboriginal person involved in their project and that ticks the box. And besides obviously being tokenistic, it's not appropriate, and you need to ensure that you have local people involved who know that community and they are the experts. You know, I had one of the Aboriginal Medical Service managers tell us how a researcher not involved in this project, but another one that they were working on with them, once said to her that she couldn't have input into the papers because she didn't have a PhD and she wasn't a researcher, and so wouldn't understand. So they were worried she would say something wrong. And, you know, that AMS manager told them, you know, I might not have a degree, but this is my community and I'm an expert in that, and I'm worried that you don't understand and that you might say something wrong because you don't have the local context and knowledge. You know, this is just one example of many bad experiences that Aboriginal communities face, even in recent years, with researchers not genuinely involving them in the project. You know, I think too often the involvement or consultation is just so tokenistic, where the partners in search felt that this wasn't the case. And so the next area was around kind of the rewards and outcomes, kind of you know, the leaves or the fruit of the project. So people in the partners spoke about empowering the community, how important that was, where, you know, communities already know what their community needs, but sometimes they don't have that data or evidence to be able to, you know, back it up to get funding or to inform policy. So through search, it has enabled them to be able to be armed with this evidence to use for their advantage, such as to revise, you know, current programs, develop new ones, make a case for more funding, advocate for policy changes. And then, as I mentioned earlier, capacity building, the partners felt that was really important, and it came out a lot in our interviews. And they also thought it was really important to have a tailored approach to capacity building, like what you know, what one community thinks they want for capacity building doesn't mean the other communities involved want that, so no one size fits all. So through search, we went around and had discussions with the AMS staff, how they, you know, how if they even wanted to do this, what did they want to do, how they wanted to use their data, how they preferred things to be presented. And the AMS staff spoke a lot about how they felt the researchers listened to them when they said, this is how I want to be involved in the research, or they listened when they said, look, I really don't have time at the moment, maybe I can just review the paper in this project because I don't have time to be more involved. And I think, you know, AMS workloads are already really high, so they felt this was really important for people to just ask them how they wanted to be involved. And the partners spoke a lot about how, you know, through search it helped to demystify research. So another AMS manager was saying that, you know, through search it's helped her to not be afraid of research and helped her to build confidence to understand it and give her the power to know what good research is. You know, now she says when they get approached by researchers, which is something that happens really, really regularly in Aboriginal communities. So she's saying now when they get approached, they go back to them and say, if you want to work with us, this is how it's going to be. And so, yeah, and the last area that people spoke about was connecting across cultures. And so the AMSs, they spoke a lot about the importance of not just having, you know, a quarterly meeting over the phone about how important it is to go out to community and show your face regularly. And also not just to have these formal meetings, but also have informal meetings where you might just go out and have a cuppa and not even talk about the project. They spoke about how important that was for building this trust and relationships and maintaining them. But they did also say that it was important to have regular formal meetings set up where everyone can have, you know, a platform to be able to voice their opinions and plan for the project ahead. And they spoke about the importance of mutual learning. So the AMSs, they spoke about how they felt they've learned a lot more about research through this process. And the researchers spoke about how they felt they've learned a lot more about you know, Aboriginal culture, the diversity of communities, how AMSs work, and also the importance of them. And also people spoke about how it's really important to take the time to understand what motivates community to want to be involved in a research project. You know, AMS staff spoke about how, you know, they don't get respect in their community by getting a PhD or being on academic papers. As one of the staff said, some researchers think what we want to hear is your name will be on the publication, but most blackfellas will go shame. What motivates the community to be involved in a project is very different to what motivates researchers. And so the community want to be involved in something to be able to use this data to be able to make real changes for their community through improved services, you know, funding and policies. And obviously with any relationship or partnership, there are going to be challenges that come up along the way. And I think, you know, what defines a good partnership is how you deal with these. And so the search partners, when we spoke to them, described how when challenges have come up along the way, because of the level of trust and respect they all have for each other that's been built over time, it's been really easy to be able to have frank discussions with each other and move forward. And so some of the challenges and areas of improvement that the partners spoke about was getting researchers to stop using research jargon. So I think it's hard sometimes for people who live in this research bubble to stop and think about the language that they're using to ensure that it's a language that everyone can understand and access, not just research people. And so I think even researchers who have the best intentions sometimes, you know, revert back to using their jargon ways. I've seen this happen at meetings before with some of our AMS colleagues and other people who don't live and breathe research, and it really scares people off and it can make them feel shame and they don't want to come back to meetings. And so, you know, it's a simple thing, but if it's not done, it can turn people away. I had an AMS staff member ring me up one time after a research meeting and they were like, wow, what were those research fellas talking about? And I explained it to them in normal everyday terms and they were like, oh, why didn't they just say that? You know, so I think researchers are sometimes kind of over here in reality, is it somewhere else? And so I think it's something they really need to be mindful of. And also people spoke about the continuing investment into research capacity development within the communities that we're working with. So I think the partners spoke about needing to do more work in the areas that the community want to be able to, you know, give them the resources and skills to be able to run their own research projects. And the partners also spoke about how, you know, it would be good if senior researchers could, you know, go out to community more and show their face more and not just the Aboriginal researchers or less senior staff.
Yeah, so as a result of looking at all this, we came up with a couple of guiding principles for building trusting relationships with Aboriginal communities. We'll just go through these quickly. A lot of it has already been covered. The first one is that it's really important to be flexible and adaptable, and recognise that one size won't fit all, especially in the context of the diversity of Aboriginal communities across Australia. The second one is really ensuring that Aboriginal people have ownership over the project, and ensuring that Aboriginal people are in leadership and decision-making roles. It's really critical to prioritise relationships and to make sure you accommodate the time to build those relationships. They do take time, but they result in really great outcomes, so you do need to build that time into a project. It's also really important for non-Indigenous and non-Aboriginal researchers to commit to developing their cultural competency. Cultural competency isn't something that you build overnight, and it's not something that you do once and then you have it. You have to continuously build on it and recognise when you make mistakes and do better. It's really important to value community knowledge and expertise, and to take a strengths-based approach when working with Aboriginal communities to ensure that the research and the project is accessible to people and they can be involved. As Simone said, some of this isn't rocket science, but it's just the way that you communicate that to ensure that everyone can participate. Another thing that we recognised that was really important was clarifying the who, what and how, so having formal agreements in place that will hold people accountable. Having noted that, it's also important to accommodate some of that informal relationship building as well. And finally, it's really important to provide resources and support to ensure that if you want communities and people to be involved in research or your project, you have to ensure there's reciprocity, and you have to ensure that you're resourcing that appropriately so communities and services aren't overburdened.
And so a lot of our findings have been consistent with other international literature around co-creation, but there were some new kind of ideas that came out that hadn't really been discussed much before. So that was around the strong, credible leadership, connecting across cultures, and valuing local Aboriginal knowledge and expertise. And so I think genuine co-creation is often seen as too difficult or not achievable or worthwhile. And so I think this example through search shows that it is possible, and the rewards of putting in the time and effort to co-create something. And this project has given practical accounts of how a successful co-creation partnership is being set up and maintained. I think it's one thing to build trust and relationships, but another thing to maintain it over over a decade. And as I said earlier, Aboriginal medical services get approached continuously by researchers, but now we are in the position of power where we can decide what research we want to be involved in. And given this history of research in Australia, I think genuine co-design and co-creation are essential when working with Aboriginal communities. And then just closing, and when we finish, we would like to acknowledge and thank all of the families involved in this project, all of the partners and the funders of search who, without them, this project wouldn't be possible. Thank you.
Thank you.